JMIR is the Journal of Medical Internet Research. And in October of 2021, a research paper was published titled Toward a Mobile Platform for Real-World Digital Measurement of Depression, User-Centered Design, Data Quality, and Behavioral Clinical Modeling. Now, that sounds like a mouthful, I agree. So let's just check out the abstract background. Though effective mental health treatment exists, the ability to match individuals to optimal treatments is poor, and timely assessment of response is difficult. One reason for these challenges is the lack of objective measurement of psychiatric symptoms. Sensors and active tasks recorded by smartphones provide a low-burden, low-cost, and scalable way to capture real-world data from patients that could augment clinical decision-making and move the field of mental health closer to measurement-based care. I bring this up because this highlights that data that can be collected on your phone, and the article talks about this, including movement, including maybe some surveys, environment, bioinformatic data collected on your phone, such as temperature and pulse and so on, eating habits. It can actually monitor your environment, and it can also monitor, along with movement, other activities. These activities actually include things like spending. So there's multiple reasons behind things such as digital currency. However, one of the things and many people focus on the ability to, what they say is, control people and control behavior. But more importantly, regular dollars, or dollars as they're implemented today, don't really provide an easy way to look at the activity and then actually extrapolate or make assessments on what type of behavior those spending habits suggest. So by unifying data that's collected from your smartphone, along with data which can be extrapolated or suggested from spending habits, you can actually develop a real-world digital measurement of depression, or measurement of someone's just mood overall. And then from there, you can actually determine, do they need more medicine? Do they need less medicine? But also, more importantly, you can then cross-reference this with other parts of their environment, other medicines they are taking or not taking, other vaccines, who they are seeing, who they are not seeing, what they are learning, what they are watching on TV, and so on. In other words, this is one of many components which are part of turning the entire life of a human being into one which is being constantly observed, measured, and assessed. Sort of like a test animal. This is exactly what you do. You measure everything, you baseline everything, you collect the data, big data analytics. And it sounds great because now you can tune medicine, but overall, this is how we actually turn the existing world population into being test animals, which can be not just experimented on, because you can't just throw bad medicine at everyone and see what happens, but also you can collect real world data and see what works and see what the impacts of things are, and so on and so forth. The only reason why I found this article is if you go through the author list, you'll notice that the second from the last is a Robert M. Califf, who is the current FDA director under the Biden administration. He was also the FDA director for the last year of the Obama administration, or just under, replacing Margaret Hamburg. And I think he was a deputy to Margaret Hamburg, or Peggy Hamburg, for a little while. Margaret Hamburg was the main FDA director for 7 of the 8 years under the Obama administration. And I would go far as to suggest that Califf and Hamburg they must have worked together more than just that. But this is where the FDA is going. It's not just to make sure you're taking safe drugs. A big part of it is bioinformatics. And this suggests that there's a lot of things going on beyond just vaccines. Yes, they need you and the rest of the human population available for vaccines and other medical interventions and gene therapy and so on. However, by looking at all the data, as much data as possible, and measuring as many things as possible, an awful lot of insights are going to be potentially collected. This is exactly the worldview that was envisioned by people all the way back in the 1960s, including, in particular, Dr. Joshua Lederberg, who spoke of this with an IBM Think Journal and, of course, at the Future of Man conference in 1963. Noteworthy that Joshua Lederberg, his best friend, was the previous FDA director, Margaret Hamburg's father, and Joshua Lederberg even accompanied Margaret Hamburg in multiple meetings, events, etc., even wrote a recommendation for her admission into Duke University. But anyways, I thought you guys would find that interesting. I don't really focus too much on digital currency here on Housatonic. It's covered in many places as far as the implementation goes. I do think that the focus on it being used to control, enslave, hurt people, etc., is the wrong approach to take it. There's something else going on, and people need to see that many of these things, the agenda, the top agenda, the big agenda, is rebuilding the world and society and nations to facilitate the use of the world's global population for medical experimentation and data harvesting. That's it. That is the overall agenda. It's not cults. It's not torture. It's not any of these other things. It's not control. It is that. I don't know. And unfortunately, this is not the viewpoint that many people are seeking. But anyways, I thought you guys would find this interesting. Have a great evening. Take care. God bless.